Hi, I'm Joseph Bergman. I'm an ophthalmologist at the Greenbrier Eye Clinic who specializes in glaucoma and cataract care. I've been with the Greenbrier Eye Clinic for about 4.5 years now. On a typical day, probably 90% of the patients I see come in for glaucoma care. And the first question that's usually asked is, what is this and why do I have it? Glaucoma, in its most basic definition or purest definition, is a condition in the eye where there is nerve damage suffered, resulting in vision loss that's thought to be due to the pressure of the eye damaging the nerve that connects the eyeball to the brain. This is a condition that often takes decades to cause detriment or vision loss. Most patients immediately come in, like I said, asking, what did I do? Did I do something? Is there something I should have done different? In reality, the vast majority of glaucoma is an inherited condition, and there's no lifestyle factors or contact point where a patient came into the disease. Rather, they were born with the genetics that put them at a risk for it. In a typical visit when the patient comes in, the next question I often hear is, well, my pressure is normal, or my friend's pressure is the same, how come I'm getting damage, or how come I have glaucoma? That's one of the most common misconceptions, is that there is a normal pressure for a patient. Sure, the textbooks, internet, etc. will tell you that, but in reality what we care about is what's healthy for a patient. And when we examine a patient, we look at a variety of risk factors and conditions in the eye to determine, is their pressure healthy for them? And if not, then we stratify how serious the condition is in order to better treat them and try to determine a strategy that is amenable both to them, but then will also keep them healthy as time goes on, and most importantly, keep them seeing. When a patient comes in, the various risk factors we look for, as I said, one is family history. This is an inherited condition for most people. We look at what their pressure is, because there is reality in the higher the pressure, the higher the risk of glaucoma. We also then do a variety of measurements and examinations that day, from looking at the thickness of the nerve to measuring or mapping the actual vision and determining whether or not there's any vision loss. So one of the tricky parts about glaucoma is it's usually asymptomatic until the very most severe form of the disease is present. So most people will have no idea they have glaucoma, unfortunately, until it's too late. The initial damage to the vision often occurs in the periphery first, out where neither you nor I would ever notice our vision being damaged. So when a patient comes in, we do a visual field test. It's a simple test where a patient is asked to hit a button when they see a blinking light, and the blinking light moves from the peripheral vision into the central vision. By doing that, it allows us to map the function of the eye or the optic nerve. By doing that, we can best determine if there's any early damage. The key to glaucoma is that the patient and the doctor work together to identify any early change the conditions within the eye to prevent further change. Early change won't change a patient's life most of the time. It'll be out in the periphery, they won't notice it. If we can stop the disease there, then we can keep the patient seeing well and functioning fully throughout their lifespan. There's a variety of ways we treat glaucoma. That's usually the final question I get from most patients. Everything from the simplest eye drops to traditional incisional surgery. Fewer and fewer patients these days require surgery, as we have many more effective topical medications than ever before. Ideally, for most patients, if the disease is identified early enough and our treatment strategies are successful, we can prevent blindness through the use of topical medications only. If topical medications fail, typically our next form of intervention is a very non-invasive, painless laser procedure that helps lower the eye pressure and preserve the functioning of the optic nerve and thereby the patient's vision. Then obviously the most significant intervention that we would ever employ would be a surgical approach to managing the glaucoma, which is something that we typically would only approach if the non-invasive topical medications and the minimally invasive laser are not successful.